The severity of hypoglycemia is based on its clinical manifestations. The treatment is based on the severity, however, all hypoglycemic episodes must be treated as a priority. During a mild hypoglycemia, the symptoms are linked to adrenaline. The person affected can still treat themselves. During a moderate hypoglycemia, the symptoms are linked to adrenaline and the lack of glucose in the brain. The person affected can still treat themselves. During a severe hypoglycemia, the blood glucose levels drop below 2.8 millimole per liter. The person affected needs help to be treated and can lose consciousness. The following are risk factors for severe hypoglycemia. A history of severe or recurrent hypoglycemia. Recurrent hypoglycemia decreases the hormonal response to the hypoglycemic episode. It's as if the body has gotten used to it and reacts less well to the hypoglycemia. In this case, the neuroglycopenic symptoms caused by an insufficient amount of glucose in the brain may appear first. An A1C below 6% increases the risk of severe hypoglycemia. A1C, or glycated hemoglobin, is the average of your blood sugar over the past 2 to 3 months. The lower the A1C, the higher the risk of hypoglycemia. Long-standing type 1 diabetes affects the production of glucagon. Glucagon is a hormone that increases blood sugars. If the production of glucagon is affected, there's a higher risk of severe hypoglycemia. Renal failure decreases the clearance of insulin by the kidneys. This means that there's more insulin circulating in the bloodstream, which increases the risk of severe hypoglycemia. And finally, some people feel the symptoms of hypoglycemia less well than others, or simply do not know what to do when hypoglycemia occurs. All of these factors increase the risk of severe hypoglycemia. The following are ways to prevent severe hypoglycemia. Measure your blood sugars frequently, as well as periodically throughout the night. Save the results in a booklet or in the glucometer. Consult your doctor about adjusting your treatment plan if hypoglycemia occurs frequently. Review the measures to prevent, recognize, and treat hypoglycemia. Review these same measures with your entourage. By definition, severe hypoglycemia means that you're unable to treat yourself. It's therefore crucial that your entourage know how to recognize the signs of hypoglycemia and know how to treat it. This course has been made possible with the financial support of Hush Diabetes Care, a division of Hoffman La Roche Limited.